Nachos crew, this is Paul, Dr. Nacho, in the Northeast on a snow day. We have a snow day surprise for you. Do you like free CE? Rhetorical question. You're a dentist. You literally like free anything. We have Dr. Fadi Hassan of the Perio Amigos here, and one of their signature courses, if you just text this word gum to 215-543-6454, you can rent soft tissue grafting with the Perio Amigos for 48 hours. So you can learn, earn CE, all from your couch on a snow day. But I'm excited to talk with Dr. Fadi. As you can see, he just finished up his day. So Dr. Fadi, I like to have people tell me about your day. What was your day like in the real world of dentistry? What procedures did you do? Tell us a little bit about that.
So pretty busy day, I would say. First of all, I hope you guys are doing well, and Happy New Year for everyone as well. So pretty busy day, I would say. Start our first day with first procedure extraction of number 9, immediate implant placement, and provisionalization for our patient, and then a few more exams and post-ops after that, and ended up with a gum graft on.
That's impressive. So you provisionalized the implant with a temporary crown?
Yeah, I usually like to use the patient's own natural tooth if possible. So I document the case from start to finish with X-rays and all that stuff. So I have everything for a full presentation for it. So I love doing that. It's one of my hobbies is immediate provisionalization whenever possible, just to make sure we preserve that nice emergence.
My hobby is trying out different bourbons, but if your hobby is immediate provisionalization, we all makes the world go around. So you did some exams that tell us a little bit about. I want to bring up some of your awesome photos here for a second. But tell us about your soft tissue grafting life as a periodontist and why that's become so popular and what you guys will be talking about at our Super Dentist Boost course.
So that one's going to be between me and my colleague, Dr. Dmitry Ivanov. Like we're going to be really going deep into soft tissue grafting between diagnosis, indications, contraindications, kind of making a decision tree for our good doctors out there and help them really guide them like what works best and which parts of the mouth and between using autogenous or donor skin and around natural teeth or dental implants. So it's going to be really focused comprehensively, and it's going to be something really fun to share our personal experience. And, I think over the last years since we've been doing this periodontics, but it's a really wealth of knowledge that I think everyone is going to really benefit from. And again, hopefully we have a chance to see you guys for our future courses.
Yeah, you guys delivered awesome material already. You're going to deliver even more awesome. Soft tissue grafting has kind of become like the bread baking of the pandemic. Everybody wants to get into it. Will this course help your hygienist, general dentist, and what you guys teach? Is it for the entire team to make better decisions? Who would be a good candidate to take a course like this?
Pretty much everyone, honestly. If you're talking about from your assistant to your dental hygienist to your dentist, it's just giving them that idea about how to develop a good decision tree, when to treat and when to refer. If you're taking your courses yourself to really improve it yourself, you're doing your own soft tissue cases, it's really going to help you break it down and doing a step-by-step. And as well, kind of educating your team as a whole, and like, again, which cases that you feel like you're confident in solely building on that to really, being hopefully one of the top leading soft tissue, gurus out there.
I think that's awesome. And one of the things I'm a big fan of as the general dentist with a focus on implants, whether it's just awareness. It's great when you know these things exist. You may do all some or none of them, but you can help your patients. Tell me, I was looking at your Instagram, Fadi, you got awesome photos. Tell us about this case here with your soft tissue allograft.
So this is a case, again, referred to us, gum recession and a lot of sensitivity. So this is a case where we did a tunnel technique, very minimally invasive, using micro instruments. That we'll be sharing as well in our course, and then kind of inserting an allograft in and then currently advancing it. This is a one sling suture. It starts from start to finish only on one knot that we learned during our residency, and that's something we'll be sharing as well and how to do it, hopefully. And this is a 6-month follow-up. Results are, again, not 100% coverage, but I would say almost a 99%. But the most important thing is we improve the patient's recession, no more sensitivity, and hopefully it's going to stand for the test of time. So we just changed the patient's quality of tissue from thin to thick, and
awesome. And Fadi, you have the same TSD, that's so dentist problem as everyone. You literally said about your own amazing work, not 100%. Just focus on the good part. You did such a good job. What happened to us dentists? Why we're always focused on the thing that doesn't go right. And my goal at Dental Nachos is to get us feeling good about the stuff that does go right. Like this case here, it's an awesome result for the patient. Just to switch gears, because you're a specialist, but you went through dental school. What do you think makes us dentists so hard on ourselves? And are we too hard on ourselves at times?
I think we are just, it's our nature. Like
Yeah.
we're type A OCD personalities. I think most dentists are, if not all of us. And just because we strive for perfection. So we are hard on ourselves, and we are best, I think, always say we are the best critiques is ourselves. So like, which is why I take pictures, I document, I look
Yeah.
at my cases again and again, just to make sure what can I do to improve. And that's something that I think everyone aspiring to really improve themselves, is that documentation is the best
Yeah.
key for us. So that's all I can tell you is like
I love you.
document.
What you and Dimitri do with photos is great. Just taking more photos in your office at any level is awesome. So you're going to be one of our Super Dentist Boost speakers. If you're watching in to get discounted tickets, another one of your favorite things, discounted stuff, dentist, text Boost to 215-543-6454. So we're breaking up the Perio Amigos on days. Dimitri's be talking on Saturday. You're going to be talking on Sunday, and you're going to be giving us an idea of how we can identify cases in our office and then get started with soft tissue grafting, the journey ourselves. Is that correct?
That's correct.
Awesome. And tell us about your hands-on courses that you've done. When is the next one coming up in general? And if people just want to follow you guys to learn when you guys are doing more stuff or follow the Perio Amigos, how can they do that?
So I mean, hopefully our next soft tissue course is when things improve. So hopefully
Yeah.
it's going to be,
We're planning for Philly. We just got to get clearance.
It's going to be Philadelphia with you and Dimitri. So stay tuned, everyone. If you guys want to follow us and know more about our courses and sign up for the mailing list, just go to our Instagram page, perio.amigos. It has a full has our website, and you can sign up, guys. You can follow me personally at fkh.implant.perio. And you can see all my cases that I share with all my colleagues. It's so please feel free to follow and tag us along. And we look forward to seeing all of you guys, hopefully sometime in the near future.
I love it. I do want to give you guys just a compliment on your JBN this, because the Perio crew, I mean, I've known Phil Fava my whole life since dental school. So I've known him, Fresh Prince of Perio, but whether it's Perio Princess, Perio Polly, Jess Lou, the Rocky Mountain Perio guys, the energy and the positivity that you guys share for each other in dentistry is really as inspiring. It's how we should interact as colleagues.
Oh my God. We talk almost on daily basis, literally. Yeah. Like we text back and forth, share cases, always open discussion, just to learning from each other and helping each other grow as professionals. And that's what it's all about, it's success for everyone at the end of the day.
Yeah. That's what I want to see more of. Well, I appreciate you sharing with us. We're going to jump off Facebook Live. Dental Nachos crew, sign up for Super Dentist Boost. You get live CE, watching live. We're going to have implants, soft tissue grafting, endo, restorative dentistry, smile transformation. Sit on your couch, watch it, earn live CE. And to get a snow day surprise, just text GUM to 215-543-6454. Dr. Fadi, thanks for being such a great part of this. We're really looking forward to your lecture.
Take care. Stay safe.